Hey there. My name is Dr. Cozy. It's really nice to meet you. And okay, so I see that we have you referred to us today because you've been having chronic headaches and some confusion. Okay. So first of all, do you have a headache right now? Okay. If you were to rate your headaches on average on a scale from 1 to 10, 1 being nothing, which obviously is not the case, 10 being excruciating, like you feel like you're going to pass out, what number would you rate the pain level? Okay. And do you know about when these symptoms started? Did they start together, or you're not sure? Okay. Do you always feel the headache in the same place? Okay. So on the right side. All right. And how frequently are you experiencing the headaches? How about the confusion? Okay, not as frequently, so. Do the headaches always occur with the confusion? I'm sorry, let me rephrase that. Does the confusion always occur when you already have a headache? Okay. Can you tell me a bit about the confusion, like what happens, what you're experiencing? Okay. Oh, wow. That sounds really scary. I'm sorry you're going through that. Are you having any issues with speech? Either slurring your words, forgetting words, unable to find them? Okay. And when it comes to the headaches, are you having any radiating pain? For example, like a stiff neck, or it's extending down the back, maybe into your eye? No. So it's really just limited to that one spot. Okay. Any other symptoms that are accompanying the headache or the confusion? For example, an aura, sometimes maybe an odd food craving, phantom smells. Okay. Okay, I think that's all the questions that I have for right now. So most likely what's going to happen is I'm going to write up an order to have you have an MRI of your brain. Have you ever had an MRI before? Okay, so you know the drill. I'm not going to use contrast. I just want to see if there's anything that shows up on that scan that might provide some answers. But before we do that, I'm going to do some examination and testing. And to start with, I'm going to test your cranial nerves. Have you ever heard of a cranial nerve exam or ever had one in the past? Okay. Well, we have a number of different cranial nerves that are responsible for lots of different functions. For example, our sense of smell, our sense of taste, hearing, our ability to track objects with our eyes, things like that. So I'm going to be testing a fair number of them, not all, to see if I can find any deficits on exam or anything abnormal that might give us a clue as to what's going on. I'm also going to do some cognitive testing in regards to the confusion you're having to see if maybe I can get something to show up on exam that we can take a look at. And then I'm also going to be physically examining your head, okay? Okay. Most of the time, we don't find anything on physical exam, but sometimes we do. So it's always good to just cover all of our bases. Oh, and one more thing I wanted to ask. Are you having any light or noise sensitivity? Okay. If the light in here is bothering your eyes, or if my speaking becomes too loud, please don't be shy and let me know. So, okay. You may be familiar with this guy right here. It is a Penlight, and to start, I'm going to be flicking it in and out of your eyes. I want to make sure that your pupils are dilating in an appropriate amount of time, as well as equally between each pupil, okay? So just gaze directly forward, looking right in between my eyebrows, if you don't mind. Good, okay. And now I don't want you moving your head. I just want you to follow my light just using your eyes, okay? So. Good job. So now I want you to focus on my light. Not yet. It's going to look like I'm going to poke you in the eye. Promise you I'm not going to. But I just need to make sure that your blink reflexes are intact, okay? Okay. So look over here. Good. Here. All right. Here. Here. And here. Good. Okay. Put that one back and alright. So now I'm going to use this tongue depressor. It's going to serve as a bit of a median, okay? So I'm going to be comparing the symmetry of both sides of your face when you make different facial expressions. Okay. So, may I have you smile for me? Really big cheesy grin. Beautiful. And now if you don't mind frowning, really furrow your brows. Okay. Can you grimace for me? Like, So now I want you to frown again, really furrow, and I'm going to try to push your eyebrows up, okay? Okay, go ahead. Good. You can relax your face. Now I want you to smile, and I'm going to try to push your cheeks down, okay? Smile. Good, okay. So now I want you to close your eyes really tight, and I'm going to try to pry your eyelids open. Close them. Good. You can open and relax your face. Alright. I'm going to take a look at your ears now, okay? Sorry. Sometimes things get caught on the floor. Okay. This is okay. Is there any tenderness or sensitivity from my otoscope? Here looks good. I'm not seeing anything concerning tympanic membrane. Is a nice normal color. And your ear is looking nice and clean too. So check the other side. Okay. How's this? Any discomfort on this side at all? Okay, good. Just need to check. This ear looks good too. I'm not seeing any redness or irritation. Your canal is nice and clean. Okay. Okay. I'm going to position my hands like so that they're out of your field of vision, but they're still right in front of your ears. I would like you to look with your eyes in the direction in which you hear my fingers flutter. Okay? Okay. So. Good. 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 Okay. Oh, come on. Sometimes those packets don't like to separate. They have like two little flaps that go like that, but they kind of stick together sometimes. It's okay. This is a very clean cotton applicator that I'm going to very lightly brush across different points on your face. I don't need you to identify for me where you feel it. I just need you to tell me when you feel it make contact, okay? Great, okay. So we're going to begin. Good. 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 Okay. Excellent. All right. Your trigeminal nerve is intact. Now these next two we're able to do kind of quickly. So I can have you close your eyes for a moment, please. Thank you. Okay. What does this smell like? Yes, alcohol. You may open your eyes. And I'm going to drop just a tiny little drop on your tongue. Thank you. Okay. Yes, vinegar. Sorry, it's not the most pleasant, but we needed something relatively strong. Vinegar is a good option. So your olfactory senses and sense of taste are intact as well. So now we're going to move on to our cognitive testing portion. Really quickly though, I just need to test your ability to recognize color. What color is this? And this. Okay. And when they're side by side, can you identify them for me? Good. What color is this? And this one. And when they're side by side, can you identify them? Good. These two together, which ones? Good. And what color are each of these paddles? Good. All right. Just needed to verify that you were able to correctly identify colors, that there is no color deficiency occurring. Otherwise, that's going to make our cognitive testing a bit of a challenge. Okay. So, this here is a sheet of different colored dots, as I'm sure you're able to see. Can you tell me, are there any green ones? Good. How about red? And how about purple? Okay. Sorry, I have a hair in my eye. So now I want you to tell me, what color is this? Is this the same color or different than this one? Is this the same color or different from this one? And is this the same color or different from here? Good. What color is this? Is it the same or different from here? Okay, how about from here? And from here? Here? Good. So now what I'm going to do is I am going to point at the dots in a particular pattern, and I want you to repeat back to me, just using the words, which colors you saw in which order, okay? Okay, so. Good. 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 Okay. So, looking at this sheet, what is the color of the dot that I just covered with my fingers? Good. So, I'm looking at the sheet again. What color did I just cover? Good. And what color did I just cover? Good. And what color did I just cover? Excellent. Okay. Alright, so far everything's looking good. You were able to correctly identify all of the colors as well as repeat patterns and remember locations, so that's really good. That's really positive. The only downside is that this testing is not providing us with any answers. So, next thing I'm going to do is I'm going to take some measurements of your head, the circumference, some symmetry measurements. I'm also going to be measuring the curvature and feeling for any kind of bumps, swelling, or anything that would be considered irregular or abnormal, okay? Okay. So, I'm going to stand up to do this. That way I'm able to get the best view. So I'm just going to put this around your head to start. I'm going to go just a little bit lower, and apologize if this is a bit invasive. And a bit lower still. Okay. These are the same size. Now I'm going to just check the curvature. So I'm going to stand to the side, place this to line up with your head. And the other side position. Okay. Do that in the front. And I'm going to put this behind your head now. Okay. Nothing abnormal there. Okay. One last thing is I'm just going to be using my fingers just to palpate your head. I apologize if you hear that humming. Sounds like radiology is running some scan. That's probably the CT. It's a bit noisy. Hopefully it's not too, excuse me, hopefully it's not too irritating. Turn your head a little here. And turn it back this way. Any pain? Okay. Do that again. I can watch your eyes. Any pain or stiffness? Good. All right. So, unfortunately, I'm not able to find find anything on exam. Only unfortunate because I'm sure you would appreciate some answers. So what I'm going to do is I'm going to write you an order to have an MRI done. And actually, I can take off my gloves now. Usually we get these scan results back the next day, but it just depends on how quickly you're able to get in to have the scan done. Sometimes it's busier than others. I'm not sure what the schedule is like right now. Okay. Okay. Do you have any metal in your body, stent, pacemaker, clips? Okay. Are you claustrophobic? ICD-9 code. Okay. All right. So very important that you are aware the MRI is really a giant magnet. So you're going to want to refrain from having any kind of metal jewelry on your body. All right. Also, if you take an iron supplement, normally it's fine, but just to be on the safe side, I recommend just skipping that day, okay, and the day before. Okay. I will talk to the radiologist as soon as they interpret that scan. It's always the same day. As soon as I have an interpretation, I will call you, and then we'll set up a time for you to come back into the office and we could discuss the results. And then at that time, we can do any further testing or examination if necessary, or potentially refer you to one of my colleagues or bring them in to examine you with me. Okay? Okay. Do you have any questions before I step out? Okay. Well, it was really nice to meet you. We'll talk soon.